lockdown from this Thursday at 11:59 p.m. 72% of our eligible population are now vaccinated. Our first dose levels indicate that this will reach close to 99% fully vaccinated towards the end of November. Our growing vaccination coverage will provide better protection for our community in the weeks and months ahead as the virus increases its spread throughout the community. Case numbers are expected to increase as restrictions are eased. But being fully vaccinated provides you with protection. It may not prevent you from getting the virus, but it does reduce the likelihood, and being fully vaccinated provides very effective protection against severe disease. As we've seen around the world, and even in places that have very high vaccination levels, the virus will continue to spread, and there will be pressures on the health system. There will be Canberrans who will need acute health care, even if they are fully vaccinated. And that's why the gradual easing of restrictions is needed. The ACT's first phase of our pathway forward will start at 11:59 p.m. this Thursday, with the lockdown ending as planned. So from this Friday, which is a little over 60 hours away, gathering limits outside will increase to 25 people. Up to 5 people will be permitted to visit another household. Licensed venues will be permitted to have 25 customers across the venue, or 1 per 4 square metres, whichever is the lesser. Alternatively, 50 patrons can utilise outdoor spaces only, or 1 person per 4 square metres, whichever is lesser. We are seeking to support business to add additional outdoor public space to allow for up to 50 patrons. ACT hairdressers and personal care services can reopen with up to 5 clients at one time. Outdoor sporting team training can resume with up to 25 people in each outdoor space. Swimming pools will reopen with no more than 25 swimmers across the venue and only 2 swimmers per lane allowed. While non-essential retail will predominantly operate under click and collect or click and deliver services until 29th of October, these businesses can have up to 2 people from the same household into a retail store at any one time for booked appointments only from this Friday. This is to allow activities like cars to be test driven and clothes and shoes to be tried on prior to purchase. I encourage ACT businesses to visit the Business Hub on the COVID-19 website. There are a range of resources there to help you prepare or update your COVID-19 safety plans. The Emergency Cabinet meeting also considered changes to the ACT's cross-border travel arrangements with New South Wales. So from this Friday, the 15th of October, the ACT will expand the standing exemption border postcodes to allow travel from a larger area of immediately surrounding New South Wales. The expanded postcodes will now cover towns such as Braidwood, Goulburn, Cooma, and up towards the Snowy region, as well as Gundagai. More details on the expanded postcodes will be available on the ACT COVID-19 website. New South Wales residents in these regions, as well as the border postcodes that are already covered by the existing standing exemption, will be permitted to travel to and from the ACT, to undertake work or study, to access schools or essential shopping and healthcare without needing to apply for an exemption. Residents in these postcodes can also enter the ACT to visit family and friends under the existing ACT gathering limits, either inside a household or outside. And we understand that the New South Wales Chief Health Officer has provided a new notice that will result in stay-at-home orders no longer applying to New South Wales residents in these postcodes when they return home. Under both the New South Wales and ACT government restrictions, ACT residents still cannot enter New South Wales unless they are undertaking essential work, accessing a childcare arrangement or providing urgent care to a vulnerable individual. New South Wales also have a vaccination requirement that excludes unvaccinated and partially vaccinated people from travel and access to non-essential activities. Work, however, is continuing with the New South Wales Government on common travel arrangements as the vaccination rates of both jurisdictions climb above 80% fully vaccinated. These more significant changes are anticipated to come into effect from late October and will be announced ahead of their commencement. So with further easing of restrictions this Friday, we ask that you continue to be careful. Keep wearing your masks indoors, keep checking into venues, keep washing your hands, doing all of the things that we've been doing for 18 months now to keep COVID safe. This will help prevent you from getting the virus and bringing it home to the people you love. Tomorrow, I can announce we will outline changes to the test, trace, isolate and quarantine arrangements that will apply and will be phased in over the coming weeks and months. But for now, I will invite Dr. Coleman to provide an update on the epidemiology of our outbreak. Dr. Coleman, myself and Minister for Health Rachel Stephen-Smith will be available to take questions at the conclusion of Dr. Coleman's update. Thank you.
Good morning, everyone, and thank you very much, Chief Minister. So firstly, I'd just like to say thank you to everyone in the community that's been doing the right thing to get us where we are today. So being over 70% vaccinated has put us in a really, really good position as we lift lockdown on Friday. For those that are eligible and not yet vaccinated, please get into one of our clinics. Please get in to see your healthcare provider or a pharmacy and get this done as soon as possible. If you do have any questions or still have concerns regarding the vaccine and getting vaccinated, please speak to your trusted healthcare provider. I'm actually really pleased to be able to stand up here today and advise that we can ease our restrictions on Friday. I know and I'm aware that lockdown has been really tough and many of you have had to make tough decisions and sacrifices over the last months. Thank you. In doing this, you have really helped to keep our community safe and put us in the position that we are today. This week, we have started to release our daily update via social media and the website, and this will continue each morning. So today we have 28 new COVID-19 cases and our total across the outbreak is now 1,262, with the team managing 450 active cases. 22 of our new cases today are linked, with 14 of these household contacts. And of the 28, 9 were in quarantine, while 16 cases presented a risk of transmission to others. But as we have discussed previously, these daily numbers are becoming less important with our higher vaccination rates and more movement in the community. We are moving towards a COVID normal, where we will actually expect to see a level of ongoing community transmission with cases. So with that in mind, the total number of cases this week remains over 200 for the second week in a row. We've previously talked about how the rolling average, the 5-day rolling average of cases has changed during our outbreak. We saw it hovering around the mid-teens until late September, where we had that increase, that sharp increase, where it through the 20s, and it peaked up to about 33 cases on the 4th of October. We have seen a decrease back down to the mid-20s since then, but I anticipate that this will continue to rise as we ease restrictions and we get back to our sense of COVID normal. As we've already discussed, the majority of cases during this outbreak have been unvaccinated at 72%, 17% have received one vaccine dose, and 11% have been fully vaccinated. I know there's been some interest in breakthrough infections. What I mean by breakthrough infections are confirmed cases of COVID-19 occurring when more than 14 days after the second dose of COVID-19 vaccine occurs. So that's for the full period of time it takes for the vaccine to become effective. We have seen a small number of these over the course of the outbreak. It's around 8% of our cases, or 101 cases. I think these figures are a reminder that being fully vaccinated is a vital tool to protecting you against COVID and, most importantly, preventing serious illness and hospitalisation. But we need to remember that you can still be infected and you can still transmit the virus. So we all need to continue to focus on our COVID-safe behaviours and still get tested at that first sign of symptoms. So of the total outbreak, we now have about 155 cases, or 13%, where the contact or source is unknown, and more than 22 cases where the source is still to be determined. As we move forward, our ability to identify the source of infection for every case is just not going to be possible, but it also becomes unnecessary. We will have very high vaccination rates, and of course, with more people moving around in the community, we will have more cases. We will be changing our focus gradually as we develop more cases in the community, and we'll be talking about that a little bit more tomorrow. When looking at where and how transmission has occurred, we have seen this occur in our homes, in our workplaces, as well as in high risk and high density settings, and in some of our high priority groups and populations. We know that there are a number of factors that can increase the risk of transmission. These include not wearing PPE, including masks, and failing to maintain COVID-safe behaviours. But we are also starting to see factors such as vape usage as a common factor in a number of our cases. Interestingly, we've seen the number of cases reporting vaping have increased from around a couple, 0 to 2 per day in early September, to 4 to 8 per day in late September and early October. So the sharing of vaping equipment has been identified as a potential transmission pathway. In the current environment, I think actions like this are undoubtedly going to increase the risk of transmission in our community. So think about everything you do where you're sharing some form of saliva or piece of equipment. But overall, we are in a great position to move forward with high vaccination rates and a cautious approach to easing out of lockdown. But to make this transition as smooth as possible, we really need everybody to continue to get tested immediately. We are still seeing people delay getting tested after they have symptoms. Please don't do this. It puts you at risk unnecessarily and those around you. Always maintain our COVID-safe behaviours. Wear a suitable mask, use hand sanitizer or wash your hands frequently, and maintain social distancing where possible. And be vigilant in monitoring for symptoms. It allows you to get tested early and, if necessary, isolate away from your family and loved ones to avoid transmitting the virus. So congratulations to you all for helping us get to this position and supporting our efforts to minimise transition wherever possible and meeting our vaccination goals. And just to finish today, my shout out is to all our local businesses here in Canberra. Some of you I know have experienced significant hardship and challenges over the lockdown period. And I know that for a lot of you this has been really tough. So thank you for bearing with us while we increase our vaccination rates and positioned ourselves really well for the safest possible way forward. Thank you very much, and I'll hand back to Chief.
Thank you, Dr. Coleman. I'm happy to take questions.
99% vaccination rate at the end of November, pretty amazing for the capital. According to the pathway forward, that's end of November to early December is when you're considering the next step after October 29. Given we're going to reach that 99% by the end of November, is there any way that that last step could be brought forward to, mid-November or a couple of weeks after October 29?
Well, that'll be something that Dr. Coleman will provide advice on. I'm not foreshadowing that today, but obviously we will, as we have been doing, monitor the situation every 2 weeks.
So where we said today there was the emergency cabinet meeting and it's okay everyone, we are on track to open on Friday, was it ever in doubt?
Well, we take the latest advice from the Chief Health Officer. The Security and Emergency Cabinet meets every day and sometimes twice a day, both operational and policy matters, but we have been clearly tracking well, both in terms of the vaccination rate and being able to maintain stability in case growth. We've not seen the exponential growth in cases that Sydney and Melbourne saw, and that's as a result of our high vaccination rates, our effective TTIQ and our public health social measures all have combined to leave the ACT in a position where we didn't go 2, 4, 8, 16, 32, 64, 128, 400, 600, 800, 1,000, 1,500, 2,000, like we've seen in other parts of Australia.
Chief Minister, just back on the border bubble, I know you've been asked this a couple of times, but you said today that people in the now expanded bubble can enter the ACT to visit family and friends, either outside or inside. What about partaking in the rest of the freedoms that will be available to ACT residents from Friday, like going to the gym or going to a pub, etc.?
Yes, so if you're in the ACT for an authorised reason, and that's included in the list, then you would be able to undertake those activities in the ACT, yes.
So just to clarify, you would have to already be in the ACT for work to go to the gym?
You're not coming in to go to the pub, but if you are here for work or one of the agreed reasons, the approved reasons, then the range of activities that you can undertake when you are here includes those that other Canberrans will be able to enjoy from Friday.
Dr. David Caldecott said this morning that calls from some for the ACT to open up in line with New South Wales are premature, and that, in his opinion, he doesn't see New South Wales as having a gold standard in terms of the response. What do you make of that tweet? Would you agree?
Yeah, I think Dr. Caldecott's a very astute observer of public health responses.
And have you been given any indication from New South Wales health authorities as to when they intend to lift stay-at-home requirements for ACT residents?
I think there's an expectation that will happen later this month when they cross a particular vaccination threshold. It could be that us coming out of lockdown on Friday triggers some further easing of their restrictions as it relates to regional New South Wales or certain parts of regional New South Wales. The two questions I get asked most frequently are, when can I go to the coast and when can I go to Sydney? I don't think either of those are likely in the short term, as in the next week or so, but they look very likely in November.
There've been, the ABC's received reports this morning that a medical practice doesn't want to have patients that aren't fully vaccinated or at least have their second vaccination booked in. We've steered away from vaccination passports and that kind of approach here. Somewhere as integral as a medical practice, do you see this as a problem?
Yes, I would. When there's obviously sensitive healthcare settings where risk of transmission would clearly need to be appropriately managed with very strict COVID-safe guidelines. But I don't think people should be denied access to essential health services on the basis of their vaccination status. But I would note that we are approaching 99% of the population with the first dose. So the number of people that this would impact is very small. But I don't think that sort of punitive approach, particularly access to essential healthcare services, is appropriate.
From Friday onwards, will we be likely to see further support for childcare centres, given that sort of office workers and public servants have not yet all been told to return to the office?
Well, so support for childcare is a Commonwealth matter, so I understand that there will be ongoing Commonwealth assistance through disaster payments as they begin to phase out, but the expectation is that that would run through the rest of October based on the current vaccination trajectory.
And beyond there, if parents are still being encouraged not to go back to the office, will the ACT government pick up some of that support?
No.
From Friday, there's obviously going to be a lot of movement of people, more than we've seen for some time, as well as expanding this border bubble now to other regions. How are we going to make sure that people are doing the right thing in terms of moving around this bubble, or is it more of an honour system at this point?
Oh no, there'll still be New South Wales and ACT Police compliance activities supported by the Australian Defence Force.
Are we going to be able to do, like, will there be checkpoints or that kind of thing, or will there just be too much movement?
There'll be a range of compliance activities. Anywhere, anytime. If you're doing the wrong thing, you're at great risk. And if you're not vaccinated and fully vaccinated and travelling into New South Wales, then you're in clear breach of their public health directions and subject, I understand, to some fairly hefty fines.
What are those compliance measures that you just mentioned?
So there'll be active New South Wales enforcement outside of the ACT and active ACT policing enforcement inside the ACT and border patrols and activities conducted between the two police forces and the ADF.
Free parking has been offered at ACT government car parks throughout the lockdown. Will that lift on Friday, or are you going to keep that in place for a couple of weeks to come?
I think that'll be in place for a couple of weeks to come.
Sorry if this was mentioned, but what about the obviously the activity outdoors, the limit of 4 hours of exercise that lifts?
That lifts, correct?
Yep.
Yes.
What about things like camping, and that's all okay?
Yes, that will be. Yes.
I have questions for the Chief Health Officer, unless anybody's got any further for you.
No. All right.
No,
Terrific. Thank you.
I was hoping you'd be able to provide the vaccination rates of all the people that have been hospitalised throughout the outbreak.
Exact numbers?
Exact numbers, yep.
Bear with me while I find that piece of information. Okay, so of those cases who have been hospitalised, we are talking to 93 hospitalised patients at this time. Those that are unvaccinated are 70. Those that have partially vaccinated with one dose is 15. And those that are fully vaccinated, 8. So that is of the 93 that we're talking about this morning.
8. Were they people that already had underlying health conditions, or is it, the breakthrough infection got in
so
bad?
The vast majority of cases hospitalised do have underlying comorbidities. Yep.
Coleman, when do you expect to see the impact of relaxed restrictions, and will the current TTIQ format continue until that eases?
So we're already seeing, I think, a little bit of the impact of some of our previous settings relaxing a little bit. It will probably take a couple of weeks to see the full impact of that, but it may well just take us a week before we start to see a slight increase. We know that the longest incubation period is 14 days, which is why we talk about having a minimum of 14 days between changing the settings, just to make sure that we're not pushing ourselves too far too quickly. But the 4-week one between the next setting and the final setting is a little bit more. It's 2 incubation periods to make us check. With the changes to the TTIQ setting, I think our aim is to do what we can do maximally for as long as we can. There are a series of changes that we will make in a progressive fashion depending on how things progress. And all of those move towards a similar goal and a similar aim, and I'll talk a little bit more about that tomorrow.
Dr. Coleman, sorry, just left my head.
you're concerned about. Do you think that also might have something to do with the age of the cases that we're seeing currently?
It's certainly more seen in our younger age cohorts. You're exactly right. And there are a couple of confounders or alternate explanation for the linkage that we're seeing here. Often it's people that are household contacts or have close contacts together as well. But certainly there is something in there, and it has been described, I think, in Melbourne as well. And there's certainly a reason or an underlying theoretical justification for it. So just don't share your vapes.
We're going to see bars and restaurants open up on Friday. Are you concerned about kind of the same age cohorts going out, sharing drinks in close proximity to one another? Do you think that will also be a factor we're likely to see in the coming weeks?
Yeah, so what we have seen in the ACT, which I think we've seen better than anywhere else except maybe Greater Sydney, is take up by vaccination in that cohort group. So that's going to allow us to see a reduced impact in what we otherwise might have seen. So particularly for young people, and I know both Chief Minister and Minister for Health have made a particular call out to that cohort of young people. Go and get vaccinated now, or go and talk to someone about it, because that's the way that we can minimise that impact of transmission in those settings that we know are higher risk settings because of closeness, because of the hugging and the drinking together. So, did you remember?
Yeah, I did, thank you. Dr. Common, what kind of case numbers are we preparing for as early as next week, or possibly after that 2-week incubation period once we do reopen? Like, how are the next 2 weeks shaping up in terms of figures?
So everything is going to be guesswork, and our guesswork will be informed by what we see today and tomorrow as we move forward and refined. So we're working towards seeing 50 cases, up to 60 cases, and then up to 100 cases per day. I'm really not sure how long that will take. We may see 50 cases per day by the mid to end of next week. It may take us another couple of weeks to get 100 cases, or we may see it happen over a fortnight. Everyone should just keep an eye on the daily updates that we give through the website and social media every morning, and we'll be updating you as we get a bit more of an idea about what that's looking like.
And here in the ACT, we know that we don't have that emphasis on having the vaccination passport, having to go around and show your vaccination status. But people here are thinking about it because in New South Wales they do have that emphasis, particularly, going to the snow and that kind of thing. So there's been a report that at a GP practice, someone has been maybe pressuring a GP to get exemptions. To not have to get vaccinated. Have you seen anything around that? Have you heard that? And have you given advice to practitioners about what they should do in those instances?
So I haven't heard anything about that, but there is a Commonwealth form and process to go through where the considerations for providing exemptions are very clear. So people can find that on both our website as well as the Commonwealth website, and that is what the advice is.
There's been talk of some outreach vaccination programs for suburbs or postcodes where the vaccination rate is lower than the Canberra average. We've obviously got one at Kipax at the moment. Mm-hmm. Are you able to provide an indication on how many programs are being planned and how many postcodes have been targeted for this?
Look, I really don't have the details in front of me, but what I can say is that we've actually done some really close analysis of which postcodes we think in which area of the ACT are experiencing challenges getting those vaccination levels up. You mentioned the Kipax area. We did a pop-up clinic or a Saturday clinic out at Harrison a couple of weeks ago. So this is about enabling us to reach groups of people where they may have challenges or difficulties in accessing vaccine. And we've seen some really, really good benefits and outcomes from this. So this often is talking about a relatively small number of people, and we might not see it exactly in our numbers, but what we do know is we are seeing people who otherwise might not have come forward for a vaccine, and every single one of those that we get vaccinated reduces the risk for both them significantly, but also for spread in these populations.
And are those same outreach services being targeted towards some of the public housing complexes around Canberra?
Yeah, so we've certainly been looking at a number of priority populations, and some of those are people with insecure housing or some of those high density living where it is challenging. And you know that we have had some transmission in some of those locations and amongst some of those populations. We've got an excellent response from people in those settings who've come forward. Often we provide a co-service of come and have a screening test or come and have a test to see whether, make sure that you're clear of COVID as well as get your vaccine. And that seems to be working really well. But we're also working with other of our priority populations around the ACT.
Dr. Coleman, there's been a little bit of talk in the kind of recent weeks about this idea that when we do open up, everybody's going to get COVID anyway. So some people are thinking that the best thing to do would be to go out now and catch it while the vaccine is still at its most effective, for example. What would your response be to that?
I think that's really dangerous, and it brings me back. It takes me back to chickenpox parties. Does anyone remember that when you were young and remember going to a chickenpox party? I think it's really dangerous to go out with the intent of catching an infectious disease. While vaccination does reduce the risk of hospitalisation and severe disease, I would never go out with the deliberate intent of catching a disease. No, take all the precautions. We don't want everybody to catch it at the same point in time. We would fall over, and that would be really, really bad for our forward plan moving forward.
But would you kind of agree with the sentiment that at some point, yes, we will all catch the disease or be exposed to the disease?
I think it's really difficult to say. We know that there will be a level of transmission and a level of ongoing disease in the community. I'm not sure what that's going to look like at the moment. It's like saying measles. So we have a high level of vaccination coverage of measles. We know that every now and again there is some measles in the community brought in by overseas, but that doesn't mean that everybody's going to catch it. So we're not quite sure about that one, and I think everybody should just continue to do what they can to reduce their risk, to think about themselves, their families and their community while we learn more about what it's like to live with COVID.
Should we expect to see in the next few months at least the disease skew towards younger populations who are the least vaccinated or children who are unvaccinated?
I think what we can expect to see is those people who are unvaccinated are going to be the greatest proportion in cases. Absolutely. So that is our under 12s. However, we are doing a lot of work on how we can protect those children until they do become eligible and we do get a vaccine registered for those groups. But I do think, so we do know that it is a missile, the virus is a missile for unvaccinated cohorts of people. That is the greatest risk. But I think that we will continue to see hospitalisations sometimes in people who are vaccinated but do continue to be very sick for other reasons, because even in those cases, COVID may tip you over a little bit. So I think it will be a range, and it will be interesting to see how that goes.
Are you seeing any sort of herd immunity in households? So the more people that are vaccinated in a household, the less likely one unvaccinated person is to get it?
Yeah, good question. We haven't looked specifically at our data yet around that, but we do have close to 100% attack rate within that, but that was prior to having very high levels of vaccination. So we'll keep you posted.
And just given the changing format to the press conferences, did you have a last shout out for the community, Dr. Coleman?
Oh, I think I'll have one tomorrow for you. So bear with me and do it tomorrow. Is that it? Thank you.
Thank you.
Thank you very much, everyone.